adoption community supporting so many other organizations and families. So we're just excited to bring her on. She will be speaking this evening regarding Adoptee Remembrance Day. And for those of you that I'm sure that have been on social media, you've seen a lot of the posts that have been going out today, recognizing, you know, there's been podcasts, live, special memorials for those adoptees that lost their lives to suicide at the hands of their caretakers, and also everything that adoptees lose through relinquishment. They're just taking this one day out. So Joyce is going to be speaking to us this evening about that very important day today. So we're super glad you're all here. If you're joining us for the first time, we're just going to do a little few housekeeping items. So Jen, Pam, where are we? Okay. This is just a little bit about us. And we do have a disclaimer that we do like to include.
So we will keep you guys on mute. You can unlock your microphone during the Q&A. You can also raise your hand virtually on the screen or by posting in the chat. This is a public meeting with no guarantee that information or identity is confidential. The presentation portion of this event is recorded and shared on our YouTube channel. We do not record the Q&A. If you're experiencing a serious mental health event or suicidal thoughts, please contact a licensed professional or the National Suicide Prevention Line at 1-800-273-8255.
Thank you, Pam.
You are welcome.
Okay, so let's go ahead and move forward with our special guest, spotlight guest this evening, Dr. Joyce Maguire Pavao, who needs no introduction. She's worked.
Shall I start?
Yes, go right ahead. We're welcome. Welcome. Well, glad to have you this evening.
I always love hanging out with you guys. I just wish it wasn't virtual. I wish we were in the lobby of some lovely hotel. But here we are. And I thank you so much for inviting me. You know, it's funny. I made up something that I was going to talk about when I first spoke with you guys. And I thought I'd talk about open adoption and how search and reunion also equals open adoption after the fact. But as I realized that today was an important day in adoption, and I think it's the first celebration of this day, which is wonderful because we have Adoption Month in November, which was created by the Child Welfare League more or less to highlight the kids in foster care and think about them. But there's nothing really about the adoptees. And although this is a sad memorial kind of situation, it's so important to acknowledge people and to really have them have a space where we can all think about them. So I like that we have this holiday, and it sort of fits with the Day of the Dead and Halloween and all of the, you know, it's an interesting ritually time of year. So I think that's great. What I decided to do, and you know, I mean, if you ever want me to talk about something in particular, you have to tell me, otherwise I go on tangents. So I thought it would be sort of an interesting thing to talk about how we got here and where we should go. I think that what I thought I'd do is I'm just going to take you on a walk through my experience. I'm 74 years old. So, and I love to tell people I've been in the field of adoption for 74 years because then they think I look really young. They don't realize I was born into it. But the thing is that I think I've watched it's, you know, a big chunk of time, 74 years. So I've gotten to experience and see a wide range of things that have gone on in adoption. And I want to apologize. This is our new puppy, who is going to be a difficult thing for the next few minutes, but we'll get over it. So anyway, I was born in 1946, and I want to talk a little bit about the beginnings of adoption. Prior to the 1930s, this could be a disaster. Prior to the 1930s, there was no adoption that was done bureaucratically. It was done kinship. I mean, there would be kids that needed homes, there would be people that could provide them, and it just happened. And names weren't changed, things weren't done. People just, put their arms around these kids and gave them a home and made them part of their life. And we know that in the best of all possible worlds, kids should stay with their birth parents. I might have to go crate this creature soon. And they should stay with their birth parents. And if that can't happen, they should stay in kinship adoptions with their family of origin. And if that can't happen, then we really, in their community, so they have contact with siblings and other families. And if that can't happen, kids need to be in families. They do much better. We know they do much better than they do in orphanages, in group homes. So a family is a really good place for a child. And none of that is disputable, really. What's wrong is what we did to it. That happened for centuries. The beginning of time, people have had situations where there were children who needed families who could help them and make them part of their own. And that just happened. But all of a sudden we got very weird. And I think it was before World War II, but World War II, and next week when you talk to Ann Fessler, she'll give you some great information about this. When after World War II, there were so many babies. So I'm 1946, there were zillions of babies. And they could match them with anyone because there were so many. So I ended up being placed with a family that didn't sound that different than my birth family. They were Irish, they were Catholic, and so was my birth family, so was my adoptive family. Oski, stop it. So anyway, would you mind if I excuse myself and put this little wicked nugget away? Come on, you're being really bad. Really bad. Really bad. Come on. I apologize. The neighbors let their dog out and you can hear so many dogs in the background. So anyway, the thing that happened after World War II is adoption became much more structured and it became a business. It really did. And I think, and all over the world, it became that way. And I think that it lost its humanity, because no one paid attention to the child. If you were a social worker or an attorney, your client was the adult, most often the adopted parents, but you were also serving the birth parents. But you really weren't thinking about the child. The child was just there. And I think that we got into a lot of trouble in not really considering the place of the child and the entire story of the evolution of that child. And I think, we also lost the situation where children needed families. And I think that's really worrisome, because it ended up feeling to many people like trafficking. And that's something that certainly has happened. This is like wildlife situation. Here's a cat now. So I think that it began to be a problem because people weren't paying attention to the needs of the child, and it converted itself into something where there was a need for children, a demand and there was a supply. And so that's how it became a business, really. And although there were many lovely people in child welfare, in agencies, in many wonderful lawyers and wonderful social workers, somehow we lost sight of the fact that this is about a child and that this child becomes an adult and that we need to do things that will provide that child with all of the best. And people have the best of interest in doing this. And I think that the adoptive parents and the birth parents and the adoptee are all victims in a certain way of the situation that was created. And so we haven't really dialed back and looked at what we're doing and how we're doing it. In the process of all of this bureaucracy, we changed names, we changed birth certificates, we did all of these things to help the adults in the name of helping the child. I think you all know the story about how the original birth certificates, if you were born out of wedlock, there was a stamp that said bastard on it. There were stamps on your birth certificate that labeled you in ways that were terrible. And so that really was difficult for people over time. And so, something had to be done about that. So they decided to just, give people new names, cover it up. There was more secrecy around it. And this ended up, as we all know, being very difficult in the long run for the adoptees involved. And so over time, I think we've come to a maturity about what we understand and what goes on. But it took a long time to get here, and we're not even here yet. There are still so many places that don't have access to original birth certificates, not only in this country, but in many. And I think that it's extremely important that we understand what this has done to the mental health of the people involved. And since today is at Remembrance Day, I think we can talk about that and really honor them in a certain way. So I grew up in the 50s. And in the 50s, everything was a secret. You never talked about anything. You never said the word asthma out loud. You couldn't say cancer. And so nothing was talked about. And it was just secrecy, huge secrecy in the 50s. And people didn't talk to children. There was no explanation to children about anything. They just went about their lives and were expected to not question things. So the 50s was really weird to be adopted. And this was before we were doing very many international adoptions. So these were in-race adoptions where kids were, they matched their families close enough in many instances that the outside world didn't have to know, but they knew. And there was no discussion, there was no talking, there was no understanding about what was going on. I remember asking my parents, about adoption, and the subject was changed very quickly. My parents were fabulous, by the way. They were very typical of their time. They just didn't have any words. They didn't have any way to talk about it. So this went on into the 60s. And of course, there were revolutions, all kinds of revolutions happening in my little hippie days. And one of the revolutions was an adoption revolution. And some of us began to search for our birth families, start groups, start to talk about things, start to write about things. And it made a big difference because we had a voice and we had other people to talk to about what was happening. And that hadn't been possible before. So in the late 60s, early 70s, I wanted to search for my birth parents. And there was no one that I knew who had done it. And we didn't have, social media. There was no way to find someone who could be helpful. So what I did, I had a friend who had just graduated law school, a young woman. And I said to her, okay, so now that you graduated law school, you have to help me go to court and find my birth family. And she said, they don't teach us that. And I said, well, figure it out, look it up. That's what teachers always say. So she did, and we went to court, and I was very lucky. We went to court and asked for my records, and it was given to me. It was before the courts began to know what we were doing and to really have some awareness about it and shut it down. So I was able to get that very early on, and I was able to help many people to do it. In the process of doing all of that, I was studying. At first, I was going to go to medical school, but then I decided I wanted to be a psychologist and a family therapist. I was very interested in families because adoptive families are interesting, and you wonder what it would have been like to be in your birth family. You're very interested in families often. So I made that my work. And when I went to Harvard, I went there because I knew that that would be a good credential for adoption. And it was. And what happened there was when I would tell my professors that I'm studying identity and adoption, they would say, there's no such thing as adoption psychology, Joyce. What are you doing? And I said, oh, yes, there is. You just don't know it yet. And so it was an interesting pioneering move. And I had a lot of people around me who were pioneers in their way. I think I was one of the very early people doing mental health and working in therapy and adoption. But there were wonderful people doing, reform, there were tons of people out there, and we were all being in touch with each other. I remember when Penny Partridge started a group in Philadelphia, the Adoption Forum, and she took a bus up to Cambridge to meet me so we could talk. And it was, we were able to sort of express what was going on in her group and what was going on in my group and how we were all going to connect to each other. And believe me, it wasn't so easy. Look at what we're doing tonight. I mean, we have people from all over on here and on every week and on other platforms as well, really talking about these things and learning a lot about each other and about what we can do and what's going on. It's fantastic because it wasn't like that. It was very dissociated in many ways. So I think, also being involved in child welfare, and I was on the Child Welfare League of America Adoption Board, we got a lot done and we made a big difference, but we didn't always see it through. You didn't see it work out. And we fought in the 80s for a Uniform Adoption Act, a federal act that would cover all of the states. And the only federal uniform acts were insurance and things of that sort. There was nothing to do with humanity. So there was not a way to start anything for adoption. And our biggest champion was Senator Carl Levin from Michigan. He was amazing, and he really understood us. And we were in his office all the time, and he fought and fought and fought, but we never got that Uniform Adoption Act through. And so that's why we're still fighting state to state to state to figure out how to change things, how to do things differently. But, whatever we could do, we did. We joined every kind of group that was doing any work in adoption. We spoke at all of the conferences that were happening. The NACAC is a great conference, mostly for adoptive families and professionals back then. And so for adoptees and birth parents to go into that group was unusual in the beginning, and very, very important for everyone to hear our voices and to know what we were doing and how we felt and how it was impacting us. So that was something that was going on. CUB was started by Lee Campbell, and that was a huge thing for the birth parents to have an organization. And then the American Adoption Congress was started way back then. And that was mostly adoptees and birth parents. And it was difficult. I remember the year I was on the board and we tried to involve more adoptive parents and professionals. And people were very, very stuck in their own little bin. They didn't want to have others. And I just could see, and many of us could see the vision that we really needed to work together if we were going to make a difference. We couldn't keep compartmentalizing everyone. That yes, you needed your own space to talk to your own people about how you were feeling, but you also needed to come together as a whole to educate each other about your experience. And that was extremely important. And, you know, I have to say, and I think Pam will agree with me here, that some of the, and maybe many others, I wish I could see you all. I know there's a bunch of people here, and I know a lot of you and love you, but I can't see you, so I feel bad about that. What I was going to say is I was very involved off and on in the AAC, just as an example, and was a great organization when it was started. And like many other organizations, and I'm happy to say this one hasn't hit that, and I hope it doesn't, there's a real difficulty because of the trauma that everyone experiences. There's just something that goes on that makes it very difficult to accept each other and to be humane to each other. I can't tell you how many times Betty Jean Lifton and I were given an award one year, one of us or the other, and the next year we were vilified. You couldn't even speak to us. We were such horrible people. And I think that goes on in a lot of organizations that have to do with very painful, very difficult subjects. And so, you know, there was an involvement of all of these things, but as we evolved, we got to see what was right and what was wrong, what was happening and what wasn't happening. This was a time when, you know, there was more international adoption, and starting with Korea and Colombia, and that was a big difference. The in-race adoptions were easy to keep a secret, but the international or transracial adoptions were not easy to keep as a secret. And so people really needed to learn how to talk about this and how to share it so they could support their children and help them to be able to speak to people when they asked ridiculous questions or normal questions. So all of these changes were happening slowly and slowly. And when there was a shortage of children, when there was a shortage of babies, and this is amazing, the things that went on in the life of adoption are amazing to me. There was a time in our history when a 2-year-old was unadoptable because they were not an infant. This was, you know, infant adoptions was what was wanted. And so if you had a 2-year-old or a 3-year-old, forget it. They were not adoptable. Can you believe that? And there were situations where, you know, people had difficulty with different countries because we were at war or had cold wars or had this or that. And some children were accepted and some weren't. And, you know, that's really not what we're supposed to be thinking about and doing. But there was a need for these children, so there was a way that they became available. Unfortunately, money is passed, and people will give you all of the information about how there's money passed when you give birth to a child of your own birth. That there's money you pay for hospitals, there's money you pay for doctors, there's always money exchanged. But that's different than what we do in adoption. And it is confusing for kids, and especially for kids who become adults, to think about how they ended up in a situation. And as we search, and as a lot of international search happens, we learn that many of these kids weren't meant to be adopted. As in this country, in the 30s and 40s in this country, you could be placed in a foster home or in an orphanage while your parents got their life together if they were having a hard time. There's many adoptees who would tell you that their mother had tuberculosis and she had to go away for a year. and the oldest sister also had it. And so all of the children, the older ones, were parceled out to different relatives, and the babies were put in care. And many of them, while they were in care, were placed for adoption against the will of their parents. That was not the point of what was going on. And the same thing happens in other countries. We found that when we see the wonderful movies of Diane Bourget, when and many other people who have done movies of Korea and China, when these people went back and found their birth families, they found that they weren't meant to be adopted, that their siblings who were placed with them in the orphanage were picked up later by the parents and brought home when things had settled, but that the youngest one was gone and they didn't know where she was. She was just gone. And so we've done some pretty shady things, and we don't even know it. I mean, most people don't know that this is what has happened. And then slowly, as we learned this, and as international adoption slowed down, and there just needed to be much more scrutiny about whether kids were really available. And so that slowed down. And then the next thing that we did was we looked at foster care and decided that we should not have kids linger in foster care, that they should be adopted. And I believe that there are many, many children that do need to be adopted. And there are many, many families that agree with this, both birth and adoptive. But most of the ones that, if we look at everything, we see that many things just really aren't as they should be. And there's something really wrong with the process in that mix. So when we started doing foster adoptions, we did something that I immediately did not think was a good idea. And, you know, used to have arguments at the Child Welfare League about this. It was during the Clinton administration, I think, that we did the Adoption and Safe Families Act. And I hated the name of it because I knew the minute it was named the Adoption and Safe Families Act, that it was going to be all about adoption. And the point of it was to move kids out of foster care and back home, or to their relatives, or to, you know, to make sure that they didn't linger in foster care forever. And everyone agreed that was important. But how it was done by giving it the name adoption was that we no longer had really good foster parents, and we didn't always have all good ones. There's some pretty bad ones then and now. But we didn't have the availability of short-term foster parents because it became the way to adopt. And so people became foster parents to adopt. And although there's nothing wrong with that in the big picture, in the little picture, there's something very wrong with it, because I'm an expert witness all the time. I have 2 cases right now where the foster parents were of the mindset that they were going to adopt this child. And the child has now been with them for a year, 15 months. And, you know, in the midst of that, they were not given the right counseling to understand that that may or may not happen. The child may not be freed for adoption. And it might be important for you to understand that you're providing a loving home for this child as we make a decision about where they're going to go. Are they going to go back to their birth parents? Are they going to go to their extended family? And yes, the foster parent who's now had a great deal of time with them may be a great resource in many ways if those other things can't work. But it can't be assumed. There's so many fights in the court of people who fight for a child that really isn't theirs to fight for. And I think that that's not the fault of those people. That's the fault of the professionals who aren't really giving them what they need to make sense of things. So we've gone through all of this, and then we've gone through donor sperm, first of all, which Annette Barron, you should read Annette's book, Lethal Secrets, wonderful book by Annette Barron. And it's about how we've done donor sperm We learned it from agriculture, and we've done it for almost 200 years. And then we started doing it with people. And so there's so much about this that has rolled on without paying attention to the impact on the child. And now we're learning more about that because time has passed, kids have grown up, there's a lot of searching and a lot of reconnection of siblings, of donors, and you see all of that going on. And then we have donor eggs, and that's another level of things that are happening. And that has not gone on for quite as long. We don't still know what the repercussions and the situation is with that. And then we have surrogacy. And so all of these things are to provide children, and it is so complex because in the process of it, if you're doing the therapy and the work with any of the parties involved, you have a great deal of empathy. Everyone is dealing with pain and loss. And yet the child doesn't get a lot of attention in the process. And it's pretty important to understand the child's perspective and to make decisions that aren't just in the moment, but are in the lifetime of the child. There are many other ways that people are connected. I'm not going to go into all the details. We have, of course, step-parent adoptions. We have guardianship. We have, there are millions of other kinship adoptions. And they didn't have to be kinship adoptions in the past. A grandmother or an aunt would raise their family member's child, but the child didn't lose their original birth certificate. Now they must, to be solidly entrenched in that family that they already belong to. I mean, I think we make some crazy, crazy plans for people without really understanding what it means to the child as he or she grows and what the message is along the way. I think it's very, I don't know, it's amazing to me that we haven't learned more than we have. I think we've come a long way, but we're still not really aware of the impact that so many of the moves that we make, so many of the things that we do have on a child and on an adolescent and on an adult who is adopted. And, the reason we have such a high incidence of mental illness and some of it I wouldn't call mental illness. I think we need to find another name for it, because many of these kids do not have a genetic mental illness. Some of them do, but many of them don't. Many of them have, post-traumatic stress, trauma, loss, all of the things that are a part of what happened to them that resulted in them being in adoption. Adoption didn't cause this for them, but what went on before adoption and into adoption is what caused it. And the reason we have all of this is because there isn't enough clarity, honesty, openness, all of those things. And so, one of the things I think is really important is to, I believe, and for years and years, this was what I was going to talk about before I changed my topic, is open adoption. And I've worked in open adoption for 40 years or something. And there are so many different aspects to it, and I don't think it's always done well. I had a clinic for many years, and we really specialized in adoption and foster care and all of the complex families. And we worked very hard to negotiate and to maintain good open adoptions. We worked very hard to make sure that people understood why you would do this. Because most people, especially if they were adopting from the Department of Child and Family Services, where maybe a parent was incarcerated and maybe another parent was addicted, and any person who knew nothing about anything would think, why would I want to keep connection with people like that? They're not people that are in my life, and I think it would be upsetting for the child, so no. But the reality is those are the family members of that child. and how do you help them to make sense of who they are in the world if you don't give them the reality. So open adoptions are, you know, if they're done correctly, they give people a chance to experience each other, to develop real relationships, and to really work together in the best interest of the child. And I've seen so many really successful ones and so many not so successful ones. But I have to say the ones that are successful are wonderful and result in a much more whole spirit of the child. And so I don't know, and I also did a lot of, I think it was Patricia Martinez Dorner was the first one to do searches and openness for minor children. And so we started doing that at our clinic and really working with families that had young children. They had done a semi-open adoption, which is at the birth, the adoptive parents might be present, and they were going to exchange letters and pictures for 3 years with the birth family, and they called that an open adoption. Well, that's really not an open adoption. It's a semi-open adoption, and it's a good thing, but it's not what we were looking at. And when the children got to be about 5 or 6, they would say, but wait a minute, it's not an open adoption because I don't know my birth mother. And they would want to meet their birth mother or know more about them. So starting at a pretty young age, we would work with families, you know, and many adoptive families by then felt safe enough that their child was their child too. And they were really wanting to do whatever was best for their child. And they could see this was a loss, this was painful, and that they wanted to do whatever they could to help. And so opening those closed adoptions was a really wonderful thing to do, and to really provide ongoing connection for a child through their, you know, youth and through their adolescence. Often those same kids would have to do a search as young adults, even though they had had an open arrangement, because they felt it was managed by all the adults and they needed to take their own place in the midst of it. So I would see over time that many of the adult adoptees would reopen their adoption to be able to do it on their own, to take charge of it in some way. And so many people who searched at pretty young ages, you know, at 18 or 22 or something, would also find themselves a little later, you know, maybe they had a not perfect reunion, maybe they, you know, really didn't click, maybe there were problems. And so they might come to another space in their life where they felt like, you know, I need to check this out again. I need to see, you know, maybe I reacted too quickly to my own feelings of rejection, and maybe I need to learn more about this. So the process and the things that we go through in open adoption are difficult. It's hard work, and not everyone loves it. Working with the two sets of parents, we always used to have mediation and meetings with them and tell them that each of them had to put their egos aside, and they were going to give up something. They were not going to get what they wanted because they were going to have to balance out in the best interest of the child. They were going to have to do some things that really weren't the first thing they thought they should do, but they would learn that they needed to make concessions so they could make their family whole in many ways. So, you know, long story short, I want to finish up because I know you have lots of thoughts and questions about any subject, not just what I'm talking about. But, well, I think starting the clinic and really starting a program that was specific to adoption. Mine was the only clinic in the country, and there's only one other that's sort of in the same vein, but it was the only place in this country, I don't know about other countries, that we were not connected to adoption placement. most adoption clinics and adoption professionals, unless they're in private practice, are connected to an adoption, a private or a public adoption agency. And part of the reason is a good one. I mean, those are people who got a lot of training and who may understand a bit about adoption that other people wouldn't have learned in school or anywhere. But I always felt like it was a conflict of interest to be placing babies and to be providing mental health services. You can't really provide transparent services to a birth mother when you're taking the child and placing it. And you can't, I mean, it's very complicated, and I felt like it was, and that we needed to have a place that was, you know, not connected to placement, because that's where the problems lie in the business of adoption. They don't lie in the hearts of the people involved. But once you get into a, you know, sort of bureaucratic situation, it changes everything. And I think we wanted a place that didn't do that. So, you know, I could say a lot more about it. It was a pretty fabulous place, and it was sad when it closed. But we really did provide some wonderful services that are now beginning to crop up in different places, but they were all in one container, which was really nice. We had programs for kids, we had programs for adolescents, we had programs for birth parents, we had programs for adopted parents, we ran groups for adult adoptees, we did, you know, everything under the sun. And more. We would, like, if we heard a need of something, we'd fill it. We'd have, like, adoptive parents would come to sit in the waiting room, because we were in Cambridge and our clientele came from all over New England. They would drive from Connecticut, from Maine, and because there was nothing like this anywhere else. So they would come and sit in the waiting room, and very quickly we realized that we had this group of adoptive parents sitting in the waiting room with each other, chatting to each other, and they needed some psychoeducation. They needed to understand more to provide more for their kids. So we took a room, and we took an intern and a therapist and put them in the room with anyone in the waiting room who wanted to go. And the adoptive parents started their own group. And they really advocated in a way that, you know, was quite amazing for their kids. They really began to understand all the nuance of what was going on, and to really be able to give more in terms of what their children needed along the way. So I think there's a lot we can do, and there's a lot that we're not doing. I think adoption will happen. People who say we should just get rid of adoption, maybe we should get rid of the name adoption. We should definitely allow people to keep their original birth certificate. That's, you know, that goes with them. That is their certificate of birth. They can have a separate certificate with, and you know, there are lots of ideas about this, about putting everybody on the adoption certificate. It could have the names of the surrogates, the names of, I mean, now there are so many people involved in the life of a child. That's not going to be a secret. So you can put it on some kind of a document, but not on the birth certificate. And I think that's really, really important. The other thing that's important is we shouldn't disconnect people. I really believe there are very few cases where an adoption can't be open. Even if it needs to be open with supervision, it's better than nothing at all. And there are very, very few that really shouldn't happen, period. So I think we should be much more open and much more connected. Children need to see their siblings. They need to know who their siblings are. They need to be related to people as well as connected to people. They need to love their birth family as well as their adoptive family. And I think that if we give kids as much as we can to integrate all of that, we're going to have much healthier, especially mentally healthier people in the world. So I'm going to stop there and see what you're thinking. What do we do next, Pam and Marcie and Jennifer?
We're going to open it up to questions. Who would like to
I
ask?
can't hear you.